Hi, welcome. My name is Sophia Baldridge, and today I'm going to be talking about my honors thesis project titled When Communities Care, Treating People with Substance Use Disorder Through a Multi-Disciplinary Team. This project was inspired by my summer internship at the Oasis Center of the Rogue Valley. The Oasis Center is a nonprofit, family-centered primary care clinic that serves patients in all stages of recovery, and their mission is to transform lives through integrated social and medical support services. What makes the Oasis Center unique in its approach to treatment is not just their medication-assisted treatment options, but their focus on community building and social support. The Oasis Center employs a multidisciplinary team to treat clients who have opioid dependency, at least one dependent child under the age of 6, is involved in at least one other community agency, and is able to accept responsibility. The MDT is comprised of representatives from DHS Self-Sufficiency, the branch that helps people receive SNAP benefits, TAMP benefits, and secure stable housing and employment. One representative comes from DHS Child Welfare. One rep comes from Jackson County Community Justice and Parole and Probation Office. One from Addiction Recovery Center. One from On Track, another residential and outpatient detoxification center. And of course, the medical and mental health staff from the Oasis Center. In embarking on my research, I realized that there is no literature about using multidisciplinary teams to care for people recovering from substance abuse. However, there is literature out there claiming that there is a need for increased research of care coordination for multi-system families and treatment programs for mothers. The Oasis MDT fills both of those gaps. Naturally, I felt drawn to this program and was interested in these 3 questions. Is the Oasis Center successful in treating patients through their MDT program? What is the most helpful part of the MDT? And how do relationships with individual agencies change with MDT participation? To answer these questions, I conducted interviews and surveys with past and current MDT participants of the MDT, 14 total people, and asked a series of quantitative and qualitative questions. All respondents were incentivized with a $25 Visa gift card. Most questions required yes or no answers, but a few were free response. I asked questions regarding participants' self-rated success in recovery while participating in the MDT, their chances of maintaining long-term recovery, what the most helpful part of the MDT was, and how their relationships have changed with individual agencies while being involved in the MDT. What I found was that 86% of respondents claimed that the MDT improved their chances of recovery, and 86% said that the MDT improved their chances of maintaining long-term recovery. The most helpful part of the MDT was agencies working as a team and increased support from the agencies. Relationships with individual agencies also improved. The most common themes we found were lack of judgment and increased trust from the agencies. 93% of respondents would recommend the MDT to other people in recovery. In conclusion, I found that the Oasis MDT program is successful in treating the majority of its members, but limitations exist within this study due to sample size and selection bias. Further studies should include MDTs in more urban areas with more participants. I would like to thank my advisor, Dr. Nicole No, and the Undergraduate Research Opportunity Program for making this project happen. I'd also like to thank the Oasis Center staff for their partnership and support on this project. Thank you.